Good evening and welcome to Cincinnati Preschool Promise Preschool Chat. Today, we will be discussing childhood trauma and the effects it has on children and families. Our guest speaker is April Barker Casey. Welcome, April.
Hi, thank you for having me.
Thank
So,
you.
ready for me to just jump right in?
Yes, ma'am.
Alrighty. So, again, I'm April Barker Casey. I am a licensed social worker. I have been in this field since 1994-ish and been a licensed social worker since 97, which is when I would have met Miss Sydney. Um, right now. So I've done a bunch of stuff in mental health in terms of inpatient psychiatry and foster care. And right now, what I do is outpatient mental health therapy at the Mayerson Center. Um, this is a little hard for me because I'm not able to see your faces, but I am a therapist, and so I appreciate like the verbal feedback. So I don't see your faces, but if you all could say okay or uh-huh or something to let me know that you haven't just dropped off, that would just make my heart happy.
Awesome.
Um, so I work at the Mayerson Center right now. Are you all familiar with the Mayerson Center in Cincinnati Children's Hospital?
We are, but tell us a little bit more. Maybe our audience may or may not be familiar.
Very good. So the Mayerson Center is sort of a one-stop shop where children go who are dealing with abuse or trauma of any kind. So 20-ish years ago, when a child said, I have been abused or somebody's touching me or something like that, they would have had to tell a teacher, and then the teacher calls the principal and then tell the principal to talk to the therapist and then talk to the police officer and talk to the sergeant and then go to the hospital and talk to the nurse and talk to the doctor. And so the Mayerson Center is a place where children can go and tell that story one time.
Wow.
Um, it is recorded and it stands up in court because the interview is conducted by a licensed social worker. And so it's designed to stand up in court, and it significantly reduces the number of times a child has to say what happened. You can, at the Mayerson Center, do that forensic interview. You can see a doctor. You would be surprised at the kinds of questions children have about their bodies after experiencing abuse. And so they can see a doctor there and they can have therapy there. So that's what I do, evidence-based mental health therapy for children at the Mayerson Center. Um, okay. Oh, and those letters after my name, I'm sorry, I just want to go back a little bit more, one more time. So those letters after my name, that is licensed independent social worker, which is the license that I have. But the other is trauma responsive care certification. So I know way more about trauma than most people find useful, sometimes myself included. But at the Mayerson Center, I have just for the past 10 years been immersed in it. And I think that's probably why Miss Sydney said, come talk to us about it. So
Yes, yes.
that is what we're talking about, childhood trauma. You can see 0 to 6 years old. That was more a reminder for me than it is for you. But the other piece is that I like the definition to be simple of trauma. And the definition I use comes from the American Psychological Association. And it's really simple. It's an emotional response to a terrible event. Why do I keep it so simple? Because oftentimes people have the same experience, but come away with it with different responses. Does
Mm-hmm.
that make sense? Yeah.
Absolutely.
Okay. And so sometimes people go through things that we think would be traumatic, and the children don't see it as traumatic, or the part that adults find that they're traumatized by do not traumatize the children. For example, I see children often who have been conned into sending nude pictures of themselves some to who they think might be somebody that they know or don't know, and it turns out to be some 30-year-old pervert in a different
Mm-hmm.
state.
Mm-hmm.
Parents are traumatized by this. Oh my God, I help my kid. I can't believe this has happened. And the child's trauma is that now my friends might see it.
Sure.
Or because I did it, now they took away my phone for a month. And so our responses are different to these events, and that is what makes this traumatic to some of us and not to others. You can go to the next slide, please. Okay, so there are different kinds of trauma, different types. And the first one that I talk about is acute trauma. So that is trauma that has happened right now, gunshots or a hurricane, something like that, a physical assault. Chronic trauma is ongoing. So bullying, um, child abuse in the home, and complex trauma is sort of a combination of the two, like ongoing sexual abuse or ongoing physical abuse.
Mm-hmm.
Any questions about any of the trauma?
Nope, you covered it.
When I talk about trauma, I use those interchangeably. I talk about all different types of trauma. But before we move on, I just was going to ask, what are some of the traumas that you all have seen with the children that you see on a daily basis?
So we do not actually service children and
Mhm,
families directly. We are a funding source and a resource to childcare providers in the community.
mhm,
Um, and so just from some of the things that you've mentioned, from acute to chronic, um, I think those are some of the most common. Those are the things that we see often in the news. Um, I did want to ask more so about, is there ever a time where acute trauma can lead to something chronic? And maybe it was a one-time event, but it has a lasting kind of chronic response or impact on the
for
person.
sure, for sure. So I see people who have maybe had an assault or something at school
Yeah.
or after school, and then it continues because maybe they see the kid at school
Hmm.
every day, um, or the children talk about it. So I've had children change schools, and then, oh my goodness, now at the new school, they now know about what happened.
Yeah. Yeah.
So it does follow them. I say all the time, when I was a kid, we used to have things happen. You would have a fight or go through something, and then you go home, and that's the end of it. Somebody
Hmm.
wants to call you and talk about it, you just don't answer the phone or you take it off the hook.
Right.
Um, that with social media is just not possible today. You can't get away from that stuff without causing more issues, because you take the phone away from a child and that seems to cause more damage.
Yeah. Thank you for sharing that.
Yeah, thank you for asking questions like that. I need that. So what I did was just list some types of trauma um, for discussion. But I do have a question because I'm very curious. I work with typically school age children. How do you all think the pandemic traumatized the younger children in this age 0 to 6?
Sure, sure. I think it was traumatic for everyone, but specifically our preschoolers. Having a consistent routine, for it to be stopped abruptly and not fully having an understanding of why. Why can't I go back to school? Why can't I see my
Hmm.
friends? Or why can't I engage with my friends the way that I used to, or my teachers? So we did find that to be a common question as to how do you talk to your children about the pandemic,
Sure.
about this illness. about being safe. And one of the things, being a preschool teacher in the past, we talk about germs and things of that nature. So that was one way to explain it to them, finding a way to being able to protect ourselves from this new germ. And once we do, we'll be able to go back and see your friends, but things will be different. So we talked about how we could express ourselves in other ways. We're used to preschoolers, they're going to they touch everything.
Sure.
But trying to give them a safe way to do it, whether it's an air hug or air kiss or a fist bump, things of that nature. But I'm not really sure how far in depth teachers really got with explaining the pandemic, or even parents of explaining, what it meant to be in this pandemic. And how has it, truly impacted their children. Some children, were probably eager to go back to school, but there probably were some that were a little bit scared now. And so I'm sure our audience would love to hear some of your thoughts, recommendations, suggestions, or even experience with, young children and having trauma from the pandemic, and how they responded to it and how adults can support children with it.
Yeah, absolutely. We found a lot of that in terms of safety. That was the first note that I took as you were talking. So a lot of it was not being very careful not to lie to kids. We don't know all the answers, but we do know that we're doing everything we can to keep you safe. And part of that is washing your hands, air hugging, staying in the house until it's safe to go out, that kind of stuff. One of the things we know about trauma is that not just children, we lose our sense of safety after something traumatic happens. And being able to regain that quickly is what helps us function best. And so after any trauma, we try to tell people to get back to a routine as quickly as possible, as quickly and safely as possible, um, because knowing what's going to happen next in terms of a routine is what helps us feel safe.
Right.
And so I can definitely appreciate the conversation that you have with young people about the safety of it all, and with their parents, because parents were also in a position of not feeling safe.
Yeah. Yeah, absolutely.
And then I love, because I just am not one to just have problems and no solution. So I love that you are able to then go back with ways that you do it in a safe manner, like air hugs or hand washing, that kind of stuff.
Mm-hmm.
Okay, so these are the ones I listed, and I am guessing that these are the things that the children are dealing with on a regular basis. And I say I'm guessing, I am not guessing, I'm 100% sure that this is the stuff that that the teachers and the staff are seeing on a regular basis.
Mm-hmm.
Um, we are conditioned sometimes to think that people who come from families with more resources are not abusive, or will not have sexual abuse in their families because they have more of the resources, but or will not have intimate partner violence. But what we've seen at the Mayerson Center is that these types of trauma cross all socioeconomic barriers, all the lines, and it just doesn't matter.
Mm-hmm.
Um, and
Even with
so,
that understanding, statistically, do you find that um, people, families, children with less resources are mostly impacted by trauma?
um, I think the impact is because they don't necessarily have the resources
Right.
to reach out.
Right.
So the initial trauma happens across the board. There's physical abuse, there's sexual abuse, there's domestic violence across the board. But people with more resources can deal with it in house a little bit. Or the flip side to that is that in healthcare, unfortunately, people tend to call the authorities on people of color more.
Mm-hmm. Mm-hmm.
And as we study and become a little more aware of what's going on around us, aware of our own internal biases, we figured that out, that it's not happening more in Black communities, for example. It's being reported more.
Got you. Okay, thank you
Um,
for explaining that.
Yeah. And so because I was curious about that, there is a website that I went to. What is it called? It's going to come to me. Kids at Risk in Action. So it's easy to go down this rabbit hole. I've listed the website at the last slide of this presentation.
Okay.
But it's easy to go down this rabbit hole of sort of looking at across America the types of traumas and um, what it looks like for different cultures. And so you can see for each day for Black children, 4 children are killed by abuse or neglect. And each day in America for white children, 1 child is killed by abuse or neglect. Each day, 5 children or teens are killed by guns, and 2 white children are killed by guns. 24 Black children die by accidents, and 15 white children die from accidents each day. And then this one just really stuck with me. 66 babies die before their first birthdays,
Mm-hmm.
and 30 white children before their first birthdays. That's such a huge discrepancy.
Mm-hmm.
Any thoughts or ideas on why?
All I can think is about is the disadvantages they may experience, their families not having those resources,
Yeah.
whether it's, adult mental health supports, uh,
Mm,
financial resources.
Generational or generational trauma.
Mm-hmm.
Yeah,
Mm-hmm. You
yeah.
said, I heard generational trauma, but you said something before that.
Transgressional
Ah,
trauma.
yeah. Mm-hmm. Yeah. And I think there are still disparities in healthcare
Yeah.
that affect us significantly. I think I heard that even Beyonce had trouble delivering her children.
Mm,
Um, and so, is everybody familiar with ACEs?
yes.
Okay. When I first started talking about this stuff, I would ask that question, and 2 people would raise their hand, like, "Yep, I know what they are." And so I can definitely appreciate talking to people who have this sort of a background. The thing that I wanted to bring up, though, part of what I was asked to talk about is how does this stuff affect us? And you cannot have a conversation about the effects of trauma without talking about ACEs. Um, how does it affect us? Ultimately, it's early death. Um, but what I wanted to talk about just a little bit is the difference in the two ACE pyramids. So here in the past couple of few years, the CDC has changed the pyramid a bit. So if you flip to the next slide, um, the bottom 2 layers, social conditions and local context, and generational embodiment or historical trauma, have been added. And that speaks to what was just mentioned about historical trauma being an issue. Why do you think those 2 things were added?
Well, trauma changes a person's DNA and affects their long-term health. So again, it's like the odds are stacked against you if generationally, your race has experienced trauma, and then when you're born into trauma or experience trauma, it's just it just makes it that much harder. You know, the odds are just stacked against you that much more.
Absolutely. Absolutely.
Generationally, there can be things that are passed down. So there can be family history issues that have never been dealt with, such as mental health, and so, or alcoholism, or even familial secrets that if they are constantly not dealt with, they can impact the health, the mental health, and even the familial bonds that impact the development and the social emotional well-being of a child.
Absolutely. Like attachment. I mean, attachment has, you know, that much it affects people at a deep level, and it affects, I mean, it's a failure to thrive is like the best example of that. If a baby doesn't receive connection and the proper attachment, they literally die.
Those are all excellent points. Thank you for sharing them. Um, what stuck out at me when I looked at that pyramid initially was how much America sort of woke up after the death of George Floyd, and it led to um, the pyramid having additional layers. And so I can definitely appreciate that conversation. We do pass things on to our children without considering. Sometimes we don't even know we're passing this stuff on. So you're right, it just gets passed on um, without our knowledge and our understanding. Okay, so the impact, because that is the other piece that I was asked to talk about. The trauma definitely affects our brain development, reduces the size of our cortex, and of course, that's responsible for memory, attention, thinking, and language. We lose 8 IQ points with unresolved traumatic experiences. It affects our sense of safety, and we've seen that. The whole world has seen that here recently with this pandemic. Leads to symptoms of anxiety, depression. We have trouble learning, and impaired memory. And definitely affects us emotionally and with our processing and our ability to sort of self-regulate. Trauma makes us hyper vigilant. We have people always looking over our shoulders, sort of trying to see who's there, what's going on, who's around us. Poor attention. I'm sure that's stuff that is being seen across the board. And difficulty experiencing joy. One of the saddest things to me is to see children who are not um, laughing, at least sometimes, at least now and then, have a smile or a laugh. And people who have had traumatic experiences, particularly when it happens before you have the language to describe it, there's a lack of joy. Thoughts about any of those impacts?
That is actually the first time I've ever heard about the loss of the 8 points.
Eight whole points.
That is very dramatic and especially in a children's learning process.
Yeah. Yeah, it makes a difference when you're in the classroom teaching people, and just knowing that one traumatic experience. This is not just complex trauma, or this is not a ton of trauma. This is a traumatic experience that has not been dealt with. The research says you lose 8 points.
I mean, it makes sense when a child or even an adult doesn't feel safe. They don't have access to that higher area of the brain. So when they're in that survival state and when they're in that emotional state, and when you think about kids also, you know, in the early childhood setting, if the classroom doesn't feel safe on top of what they've experienced or what they are experiencing, then how are they learning? Well, they can't actually.
can't.
They're not learning
can't.
because
Mhm.
they don't have access to that area to learn or to recall information that they've learned previously.
I'm curious, what is the youngest traumatic victim, so to speak, you've ever seen?
Sadly, they bring babies into our, at least weekly, we get babies, 5 months, 8 months. Yeah. And so at the Mayerson Center, so prior to me being at the Mayerson Center, um, I do this work. I'm a social worker. I'm a licensed social worker. So I do therapy. I am good at hearing people's problems, helping them sort of process them and deal with them, and figure out what to do about it. But when I got to the Mayerson Center, every week there's a team meeting where they literally show the cigar burn on a kid's leg or the broken arm, and there's a question like, mom said the kid fell to the floor, and the doctors review the x-rays and say, no, you would have had to twist this bone or this arm, or you'd have had to shake this child in order to do that. And so to get that kind of fracture or that kind of picture on an x-ray. So I see them really young. And after about 3 years of going to those meetings, I had to stop because I can't keep seeing that, and still be effective at doing the therapy piece that I do. So I stopped going to those meetings, but weekly, Sydney, they come in and they're very, very young.
Mm.
And I think for me, the worst part is how you can't deal with that when you're young. There are no, you need to have the words to say what it is you're feeling, or you need to have the even the wherewithal to draw it out or dance it out or something to be able to
Right,
get some of this energy out. But when you're that young, you just don't have that resource. You can't access that.
right. So when in those cases, even though we're focused on preschool, we know that you know, families have younger ones, our childcare providers also service younger ones. How do you support a infant who or a toddler who has experienced trauma? I mean, you talk about the loss of the 8 points
Mhm.
and the anxiety and other things going, the loss of joy. How do you support a baby?
Yep. So not my area of expertise for sure, but at Children's, there is a place, I'm trying to think of the professional title. We call it baby tip, and that is not what I'm supposed to tell you. It's called therapeutic intervention program, and it's from 0 to 18 months.
Mm,
And they give parents resources, but also there are techniques that you can do with children that ease some of the physical pain and some of the anxiety and the um, those restless sort of feelings that they have after something traumatic happens.
okay.
And so to answer that question, honestly, I don't know, but people at Children's do know, and that is a resource. So
Okay.
in
Oh,
terms, oh, go ahead.
I wish my family knew about this when I was a baby. I got attacked by a bird and I was like in that
Ah,
18-month, like to
mhm.
like right before I turned 2 age. And they laugh about it till this day, but I am still like terrified of birds.
Yeah.
And they have a picture of me like in mid attack, and my whole family had to like go and like fight off the bird with brooms and
Mhm.
everything else. But till this day, I that's a vivid memory I have of being
Yeah.
under 2 years old, of a bird coming out and like viciously like going for my head and trying to attack me like full throttle. So like we needed
Mhm.
this information.
For
Yeah.
sure. Sounds like it.
Yeah, so I'm like, oh my gosh, there was something for that. Cause like you talk about traumatic. I see a bird now, I'm like, let's wait, let's go the other way. No, thank you.
I can believe that. Um, Okay, so this slide is also about the impact. What I wanted to do is talk a little bit about what like people see on a day-to-day basis. Um, I, for a long time, trained foster parents, and you would go through these, I don't know, 40 hours of foster parent training, and you would know for sure, like children hoard food, children are not automatically grateful. So you would know that. But then when you have the foster child sitting in your face and you're saying, like, I can't find the apples in the house. Well, last month you learned that children hoard food. This is what that looks like. So it just, I think, helps when you can like connect the two, help people connect the two things, the book stuff and the day-to-day stuff. So I just wanted to
Mhm.
talk about the impact and what it looks like with children sitting in front of you. These are the
Mhm.
kids who have poor verbal skills and who have memory problems. You can say every day, we come in and take our coats off and have a seat. And they can sing it back. Come in, take our coats off, have a seat. And there's two in the class that are just not able to do that. They don't know what to do next.
Mhm.
Um, so the excessive screaming or crying, digestion problems, acting out. You see lots of children who've had traumatic experience. They imitate aggression. Um, they have somatic symptoms. My head hurts all the time. My stomach hurts. And just poor self-confidence. They won't try anything new.
Mhm.
And so again, what to do? This comes from, there's an initiative at Children's called Joining Forces with Children. And it involves several different, it's a collaboration. So it involves some schools, some doctors' offices, some other community providers like therapists. And the goal is to reduce or prevent trauma. And so joining forces, and I again have that that website on the last slide, but joining forces has come up with 7 core ideas that help foster resilience. And there are the 7 C's. Um, Competence, just helping children build and understand their own skills. And so I love the example given earlier, like these are the ways we keep ourselves safe. We wash our hands or we give air hugs because that helps kids. It sort of empowers them to know that there are things that they can do for themselves.
Mhm.
So building their confidence is important. And then helping them gain a true belief in their own abilities, which is what we just talked about. Connecting them with other people that help further their support system. Um, just like um, the woman said that it would have been nice to have that connection um, to baby Tip at the time that she needed it. Um, Building character, helping children have a clear sense of what's right and wrong. Um, let's see, contribution. So there's something to be said about helping others when you can do something in service for other people, regardless of how big or small. It gives our brain extra shots of dopamine, helps us to feel good. And so when we deal with children who lack joy, one of the things that we, not just children, adults even who are depressed, one of the things we get people to do is some sort of community service, something in support or service of other people. Let's see, coping. just being able to self-regulate is huge, and then control. So what you can control, um, so much is out of our control, but the things that you can control, we just try to help children have some more of that. Questions about any of those 7 C's?
I don't necessarily have a question about the 7 C's, but you did mention that you would talk to foster parents and, help them to understand what was going on with the children. How receptive are the parents when a trauma has come to be and they just don't want to take that on, so to speak?
Mhm. Um, so so I think it depends. So sometimes people come and they don't want to deal with it, but are forced to because the authorities say this is what you need to do. Sometimes people come and they don't necessarily want to engage because of their own history of trauma. And so there's sort of a blockage there that prevents them from wanting to engage. So I think um, once you understand the reason, then then you can be more helpful. Most people, though, want what's best for their kids, and most people will engage and make sure that their children are okay, just based on I want the best for them. I've had people, just because of the role that I play at Marison, I've gone to the VA to learn how to treat adults with PTSD. And I've had adults in therapy sessions like cussing me out, um, but saying, I'm only doing this for my kid. And how dare you make me relive this crap that happened to me? Or like, you're making me think about it. I don't want to, but I'm doing it for my kid. So for many of us, for most of us, that's the driving factor. Um, the other thing, I don't think I'll put this slide in because I saw the next one, and that is actually the last slide. But the other thing that I usually talk about when I do these talks is what do you do that's helpful, which is sort of what came up. So there's baby tip, of course, but there is other sort of evidence-based therapies that are very helpful. I use cognitive behavioral therapy. Actually, I use TF, so trauma focused cognitive behavioral therapy. Um, there is a cognitive behavioral therapy for families called Alternative for Families. I use that as well. There is a shorter term sort of crisis intervention type therapy that I use. And there is something that is more common in school called CBITS, I think. So cognitive behavioral intervention for trauma in schools. So there are several different kinds of what we call evidence-based therapies that people use to help children get past some of this stuff. And there's always the tried and true therapies like play therapy that people use that are very helpful.
Mm-hmm. Is it your professional opinion that anyone who experienced trauma should seek professional support?
So I'm a therapist. The short answer is yes. But I also know that what makes a difference for people is the presence of one caring person.
Mm-hmm.
The research says that makes the biggest difference, and a skill set. And so if you can relax a little bit, if you know how to calm yourself when you start to feel anxious or have flashbacks, that kind of stuff, and if you have a person in your life that you can count on, then therapy is not always necessary. But of course, I'm a therapist, so I'm always going to say therapy is beneficial. But I think therapy is beneficial even if you don't have a trauma.
Mm-hmm.
I think it's important just to talk some things through. I'll tell you, I was a brand new driver in North Chicago, Illinois, when my mother said, go and pick your sister up from school. And so I get in a car and pick her up. And so I'm like 17, which would have made her about 12. Um, we get on a road and it starts to snow, and the car slides and hits the curb and bounces back into traffic.
Mm-hmm.
My sister, who is the smart one, had her head in a book the whole time.
Mm-hmm.
Okay. So I pull back at the house and get out the car, and I'm a nervous wreck. My legs are like jelly.
Mm-hmm.
My knuckles are still tight because I was gripping the wheel so hard. My voice is shaking. My mother's like, what the heck just happened? Oh my God, Mom, we almost died. The car slid. My sister's like, yeah, we slid, but she had it.
Mm-hmm.
My mother said, well, praise God. And we sat down to eat.
Mm-hmm.
Okay. So years later, after I go through all of this trauma certification stuff, I asked my sister about that event. And my sister said, she said, first I couldn't even tell that you were nervous. I was like, you didn't hear my voice shaking or any of that? She said, no, I didn't know that you were nervous. She said, but really, it didn't bother me at all because I knew you had it. You're my big sister. I knew I was safe. And so just the presence of somebody who may or may not have been able to keep her safe made her feel safe.
Mm-hmm.
And the way that my mother dropped back into that routine, she said, well, praise God, let's eat. So we just
Mm-hmm.
ate.
Mm-hmm.
My legs calmed themselves down. Something about chicken that will do that for you. But
Mm-hmm.
but we went back to our routine. But I will say this, every time I went back to that spot, whether it was rain, sleet, snow, sunshine, my knuckles gripped the wheel every time until I realized that all you have to do is breathe.
Mm-hmm.
And so when I took these trauma courses, I realized that that's the very first thing we teach people is how to relax themselves. So somebody to teach you the skills of self-regulation, of relaxation, of problem solving. So you can think about it. If I go back through there and this happens again, I can do blah, blah, blah.
Right, right.
And so just my own experiences helped me understand a little bit more the things that I'm now talking to people about. All right, other questions about any of that? I do encourage you to go to Joining Forces for Children. They offer all kinds of trainings and materials for professionals to use in day-to-day work. So that's another page, website that you can get lost on.
Okay. For children.
So, what was the catalyst to develop your interest for children, so to speak?
For me, like, why am I working with children or in trauma?
You can answer both.
Okay. Okay, so only you, Miss Sydney. So I was in the first grade when a little girl I was in North Chicago, Illinois. I still remember her to this day. She told me that her mom's boyfriend was touching her no-no spot when we were in first grade. And he had been doing it at night when her mom went to work. I was, what are you, 6 in first grade? I didn't even know that I could tell my own mom that. I had no idea what to do about it. And so for recess, Sydney, this is for you. So for recess, we would sit down And sometimes she would want to play and I would play jump rope or hopscotch or whatever. And sometimes she would just want to sit and I would hold her hand and we would sit. Her name was Jackie, and I do still remember that. So what I told myself is that I'd never ever wanted to be in a position where somebody needed me to do something like that and I didn't know what to do. And so I became a social worker. And I tell my friends now that I will do whatever they need, including sit on the curb with them and cry if that's what they need. And that's where that came from. And so why I got into trauma is because I was at Children's Hospital after losing a job to budget cuts in a nonprofit, and children said, we need a trauma therapist. And I said, I can do that. And so I've been doing that for the past 10 years.
Okay.
Other questions? Thank y'all for letting me ramble for 45 minutes. I appreciate that.
Thank you. It was a pleasure, April. We now have some more insight on childhood trauma and the effects on children and families. And we have some great resources. And I will personally be checking into the Joining Forces for Children and seeing what I can pull out and share with our network of providers and preschool parents.
It's an excellent, excellent collaboration with several different agencies. And so I think that's great.
Thank you so much. Thank you all for tuning in to Cincinnati's Preschool Promise Preschool Chat. Until next time, take care.